I come to you today from the traditional territories of the Mississauga of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat. Je vous adresse ce matin des territoires traditionnels des Mississauga, Anishinaabe, Haudenosaunee, et Huron-Wendat. We are here this morning to speak once again about a guaranteed livable income and the promise that it holds for us, particularly post-pandemic. This is the time to begin to plan for our future and how we can ensure that every single person in Canada can live in dignity from the first day to the last day. And of course, we are convinced as a party that a guaranteed livable income plays a part in that. I am so pleased today to have with me Senator Kim Pate and Mr. Jonathan Brun, who I'm going to pass over most of the time to speak this morning. I really see this as an education opportunity always to explain to the public and also to fellow policymakers why a guaranteed livable income is almost inevitably going to have to be part of the solution if we are going to ensure that everyone has a social safety net beneath them. We were very pleased and relieved on behalf of thousands and thousands of Canadians to hear last week that the Canada Recovery Benefit was going to be extended. That is certainly positive news, and I know a lot of people are breathing a sigh of relief. However, this is a 12-week extension. And so now is the time to begin to talk about what is going to replace it. What will be the permanent replacement? Because we have seen during this pandemic how many people would have fallen into complete financial ruin had there not been emergency benefits put in place, underlining the fact that there are still many people who cannot expect to be covered by any of the existing benefits. And there is no question that many Canadians live in precarious conditions. There's no question that our piecemeal system has not succeeded in covering everyone. And for this reason, there is a growing momentum about the need to investigate a made in Canada guaranteed livable income that would provide that basic protection for all people in Canada. And as I said, that net beneath them. Alors, moi, j'étais comme tout le monde, c'était vraiment une très bonne nouvelle de savoir que le gouvernement a décidé d'ajouter par 12 semaines la prestation canadienne. C'était une très bonne nouvelle de savoir que la prestation canadienne de la relance économique serait disponible pour encore 12 semaines. Mais maintenant, c'est le moment de penser à l'avenir, c'est le moment de penser à que serait le remplacement pour la prestation. Parce que la crise a révélé qu'il y a beaucoup de personnes au Canada qui vivent dans des conditions très précaires et qui n'ont toujours pas de filet de protection sociale de base pour les protéger en période de difficultés financières. On sait que notre système, qui est un système fragmentaire, un système assez ad hoc, que ça ne garantit pas que tous les Canadiens et Canadiennes soient protégés dans les moments où ils ont le besoin. Alors, un revenu minimum garanti, c'est quelque chose que le Parti vert soutient. C'est quelque chose qui offrirait une plus grande sécurité aux Canadiens et Canadiennes les plus vulnérables, les travailleurs et travailleuses précaires, les sous-employés, les sans-abri. Et c'est quelque chose qui assurait que tout le monde a un filet social disponible et quand il aura le besoin. Alors, pour nous, le but de ces tables rondes, c'est d'éduquer, c'est de continuer à bâtir le momentum vers un revenu minimum garanti. C'est mon plaisir d'avoir Jonathan Brun et Senator Pate avec moi aujourd'hui. I'm first going to pass over to Senator Kim Pate. Senator Kim Pate has been in the Senate since 2016, November 2016. She was formerly the executive director of the Canadian Association of Elizabeth Fry Societies and has been a tireless advocate on behalf of the marginalized, the victimized, and in particular youth and women. She is someone who I am very grateful has taken on the mantle of being an advocate for a guaranteed livable income. And I'm looking forward to, as much as I think we all are, to Senator Pate's remarks this morning. Senator Pate, over to you.
Great, thank you very much. And I'm very honored and thankful that you invited me. I come to you from the unceded, unsurrendered territory of the Algonquin Anishinaabe. And particularly this month, when we're recognizing the heritage of Canadians of African descent, that we actually also acknowledge the labor upon which this country was built, much of it unpaid, much of it enslaved, and too much of it not acknowledged in the past. So, and you know, as you've indicated, it's really the history of the work that I was doing that brought me to guaranteed livable income. Working with those who are young people, men and women who are predominantly on the margins, who are overwhelmingly criminalized and imprisoned largely because of the intersections of the marginalization they experience. And what I mean by that is, as we're having this discussion, full 44% of women in federal penitentiaries are Indigenous, 10% are Black. If we look at who's, you know, the poverty levels, 80 to 90% poverty, which the intersections of who gets out and who has supports in the community, it's very clear that it's more a function of your privilege than it is your risk to public safety as to whether you end up either criminalized or incarcerated. And so you might wonder, well, how does that get you to guaranteed livable income? Well, when you know that the majority of people start in a position of economic deprivation, where they experience the discrimination of not having the same opportunities, then you start to look around for how do you actually address some of those inequalities in ways that make it less likely people will be marginalized, victimized, criminalized, or institutionalized, whether that's in prisons, in long-term care, in psychiatric hospitals, or in homeless institutions that basically are trying to address after the fact homelessness. And so that's really what brought me to this. And so, but it's also something that during this pandemic, it was laid bare. It's, you know, anybody who wasn't aware of it really probably was because of their level of privilege, may not have been aware of the gaps in the social, economic, and health systems that existed and that were, again, exacerbated on the basis of economic deprivation, racism, sexism, ableism. And so we've seen during this pandemic who we relied on. Overwhelmingly, the people who we were relying on to provide us with the services we considered essential were people who did not have economic security in terms of wages or benefits, overwhelmingly racialized men and women who were oftentimes new to the country or first generation in the country, and oftentimes people who were trying to make a living in more than one or two full-time, often minimum wage jobs without those benefits and still not able to make ends meet. So we know that a full, it's somewhere in the neighborhood of 90% of those who are working full-time in minimum wage jobs cannot afford to even rent a studio apartment, let alone a one-bedroom in most centers in this country. So we're talking about people who are, some people are unable to work, whether it's because of disability or dealing with past trauma. And this has, of course, been very much underscored by the Truth and Reconciliation Commission, as well as the Missing and Murdered Indigenous Women and Girls Inquiry. And we know that when you don't actually meet the needs of people throughout the system, whether it's social, economic, health needs, then the only system that cannot refuse them is our criminal legal system. And so we end up with increasing numbers of people, the more the more intersections of marginalization, the greater the likelihood you see people who can be criminalized and imprisoned, because it's the only system that cannot refuse them, cannot say they don't fit the mandate, cannot say the beds are full. And so that's what really brought me to looking at these issues. And as we're having this discussion, as we've seen during the pandemic, when the government chose to exercise its spending power to immediately pivot, they did an excellent job of rolling out emergency benefits. Unfortunately, they missed about 1 in 7 or 1 in 10 Canadians, people in Canada who weren't eligible for it, and so still fell through the gaps. As well, people who did apply for it but may have been on social assistance or in disability now find themselves being dumped off the system and the resources being clawed back. So it really underscores the need for us to pivot to the type of approach that that was signaled in the speech from the throne, that would be looking at an automatic tax filing system, which would lend itself very easily to a guaranteed livable income through that process, through the CRA rolls, and a way that we could actually ensure that people could have resources. So right now, the opportunities to revamp employment insurance that's great. We still need social services. We still need childcare. We still need pharmacare. We still need dental care, mental health care, but we also need resources. And it was interesting recently when the BC government reports were released. It's been described as saying, "Oh, we know, basically there's not a strong case for basic income." If you actually read beyond the summary, quite the opposite. There's a very strong case for basic income. And in fact, no credible advocates for basic income are arguing for the demogrant model that is essentially nixed in that report. Nobody, credible is calling for that, nor are they calling for something that is only about income. But also, nobody credible is saying services alone can solve it. When people need money, have no money, that's what they need. And we know that when people receive, particularly people who are already experiencing poverty, when they receive the resources, those resources go right back into our economy and are reinvested in the economy, whether it's in rentals, in terms of accommodation, food, clothing, the things that people need to survive. And so really the time has come. PEI is already has written to the government, has indicated they want to start piloting the implementation process, and much the way Medicare started in this country, with one province, Saskatchewan, starting. And then once Saskatchewan started, every province and territory wanted to participate. And despite all the naysayers going, much the same as we're hearing now about guaranteed livable income, everybody came on side. And now it's one of the things that distinguishes Canada internationally, and one of the policy decisions that nobody has been game, no government of whatever political stripe has been game to roll back. And so I think the time has come, and we have seen during this pandemic very real need for it. There are still people falling through the cracks, and we need to rebuild I would say build a social safety net, because it's been some time since we had a real viable social health and economic safety net, and now's the time to do that as we face potentially the third wave of this health pandemic, but the ongoing tsunami of the economic pandemic that far too many people, particularly those who are most on the margins, have been facing for decades. So thank you very much again for inviting me.
Thank you very much for being here, and thank you for really getting to the heart of the matter. It's incredibly well put. This is the time to go to the root causes. We have had an extraordinary reminder over the last year about how things are interconnected, and about how one thing leads to another. And we do, I agree, have such an extraordinary opportunity to really get to the root causes, to really attack those, to really meet the fundamental needs of people. And as you said, to understand how that has a beneficial impact far beyond what initially meets the eye. So perhaps we'll have a little bit of a chance for an exchange afterward, but I wanted to pass now to Jonathan Brun. Merci d'être avec nous aujourd'hui, Jonathan. Jonathan est le directeur de Francophone Network, Revenu de base Québec. Il est le directeur pardon, aussi le fondateur. C'est une initiative des citoyens qui campagne pour une revenu minimum garanti au Québec. Jonathan is the director and founder of Revenu de base Québec, a citizens initiative that campaigns for a basic income in Quebec. Jonathan, je vous laisse le parole pour aussi élaborer et éduquer. Merci beaucoup d'être avec nous aujourd'hui.
Avec plaisir. So I'll do my remarks in French, but I'm happy to answer questions afterwards in English if necessary. Alors bonjour tout le monde. Merci beaucoup d'avoir organisé cette conférence ce matin, sénatrice Pate et Annamie Paul. Je suis très heureux de discuter du revenu de base dans le contexte du Parti vert. Donc, je vais peut-être sauter par-dessus les principes de base de revenu de base parce que je pense que la majorité des personnes qui écoutent une conférence comme celle-là sont déjà au courant. Mais en effet, je pense que la pandémie démontre que notre filet social a encore beaucoup de trous, beaucoup de problèmes et un revenu de base pourrait permettre de compléter, pas pour tout le monde bien sûr, mais pour beaucoup de gens, notre filet social. Alors, Revenu de base Québec est un organisme au Québec qui milite pour un revenu de base depuis 2014 et je travaille également avec UBI Works qui est un organisme pan-canadien qui travaille sur le revenu de base à l'échelle du Canada. J'ai pas beaucoup de choses à dire ce matin. Je pense que la sénatrice Pate a déjà dit beaucoup sur le sujet du revenu de base. Mais dans le contexte du Parti vert, je lancerai quelques idées pour qu'on puisse réfléchir ensemble potentiellement. La perception du revenu de base du public en général, selon nous, Revenu de base Québec, dépend beaucoup de son financement. On ne peut pas parler de revenu de base sans parler de financement parce que les montants qui sont impliqués sont tellement importants qu'on ne peut pas juste dire on va trouver cet argent un peu n'importe où. Et dans le contexte du Parti vert, je pense qu'il y a une très belle opportunité de financer le revenu de base avec quelque chose lié à l'environnement, que ce soit des crédits carbone, que ce soit des crédits qui sont émis lorsqu'on fait des améliorations énergétiques, la vente des voitures électriques, la mise à jour de nos industries, de nos maisons. Je pense que le Parti vert a un rôle à jouer pour parler non seulement du revenu de base, mais également du financement du revenu de base et comment on peut construire un programme qui est durable et pérenne. Et c'est une discussion bien sûr beaucoup plus large, mais je lance cette idée parce que pour l'instant, j'entends beaucoup de discussions sur le revenu de base comme quoi ça va aider à sortir beaucoup de gens de la pauvreté, ce qui est tout à fait vrai. Mais le revenu de base aussi peut être perçu comme un droit de citoyenneté. Ça peut être perçu comme l'assurance maladie, comme la sénatrice Pate a mentionné, comme un droit. Si on est Canadien, on a droit à un revenu de base. Et la perception politique d'un revenu de base, que ça provient du Parti vert ou d'un autre parti, est essentielle pour avoir l'appui du public général. Alors, je lance ces idées comme ça et je serais très curieux d'avoir des questions ou des retours, soit d'Annamie Paul, sénatrice Pate ou des personnes qui sont à l'écoute sur Facebook. Mais je pense que c'est absolument essentiel de mettre en place un revenu de base, non seulement pour aider tout le monde à sortir de la pauvreté, éviter les coûts qui sont reliés à la pauvreté, qui ont été très bien décrits par la sénatrice Pate, mais également de changer la perception de l'aide sociale, changer la perception de la citoyenneté canadienne et nous diriger vers une économie qui est plus équitable, plus juste et où personne est en pauvreté en 2025. Alors, merci beaucoup et je serais très content d'avoir vos questions en français ou en anglais.
Merci beaucoup, Jonathan. Thank you very much. And yes, this is the moment. This is the moment, absolutely. C'est le moment de considérer les modèles, les options. C'est le moment d'éduquer et absolument une des raisons que le Parti vert convoque ces tables rondes, c'est d'éduquer, de changer la perception. Alors, oui, merci pour ça. Merci pour avoir introduit des autres idées dans le mix. Thank you so much for introducing those ideas. We absolutely understand that perception and education with respect to a guaranteed livable income is so important. And perhaps in our last couple of minutes, I would just note that There are, Senator Pate, Kim mentioned the model that is being developed out in Prince Edward Island. And of course, there is growing momentum across Canada for a guaranteed livable income, whether it is the 50 senators who signed a letter, whether it is the Liberal caucus that has indicated this is their top policy priority to discuss and consider. Of course, our party, the NDP, it's what we want to see, because this is something that really should not be a partisan issue. It's something, as Kim and Jonathan have said, is something that is essential for completing the social safety net. And that work is not done. We have not completed that work, and we know we have everything that it takes if we decide that we want to make that a priority. Alors, I wanted to thank you both for discussing some of the perceptions, because Kim, Senator Pate, I find that is one of the things that advocates struggle with, the perceptions about what a guaranteed livable income is or is not. I mean, what would you say to those, I'll just maybe pass that as the last question to both of you. What would you say to those who see this as either unaffordable or as a disincentive to work?
Oh, my favorite questions. Thank you. Well, we are now paying an awful lot of money to keep people down. So we spend tens of billions of dollars a year to incarcerate people. We spend billions of dollars on social assistance in this country. And we know that it is expensive to keep people in poverty. And we know that from the few models that have been implemented, the pilot in Ontario, as well as the Mincome pilot or the Mincome project in Manitoba, that when you implement this, two things happen. One, the only people who tend to stay home more are those who are trying to get an education, who are trying to get supports in place so they can get a better job, or those who are caring for people, whether it's children, elderly people, family members with disabilities. And that in fact, we could set this up so it would be, in fact, provide a springboard for people to rebound out of poverty when things like a pandemic hit or some personal situation, accident, some life circumstance that causes people not to be able to be in the workforce or not to be able to participate. And so I think that it's the cost savings of the criminal legal system, the healthcare system are immense. And Dr. Evelyn Forget has documented this well. Hugh Siegel has talked about it. In fact, I was just not that I tended to have props, but 50 years ago, the Senate Kroll report on poverty talked about the need for this kind of approach, and that if we invest now, there will be some initial costs to implement, but the cost savings will come. And part of the explanation for why many governments have not been willing to start on it, much the same as the arguments were about Medicare, is there'll be an initial cost and the benefit may not be seen in 1 or 2 or maybe even 3 electoral periods, but we will see it. And now, as we are also talking about how do we talk about economic recovery in a way that is sustainable, both in terms of climate and environmental issues, but also sustainable in terms of people and humanity. And one of the things we know is that this is one of the ways we could actually achieve a more sustainable economy that doesn't just rely on GDP, but also looks at the quality of life and the quality of healthcare and the quality of options for people in the country. And so I think I've been in a number of conversations with OECD countries in the last couple of months, and everybody is looking at how can we develop and come out of this pandemic, not just with everybody healthier physically, but also with something that's healthier for the entire planet. And I think so. This is good for the country. It's good for individuals. It's good for us collectively, and it's good for us globally.
Jonathan.
Sure. So, I'll answer in English just so that it may be a little bit easier for everybody. The short answer is it's complicated. The long answer is long. We've been thinking and talking about basic income for, at least in my case, about 10 years. And once you start to get into the details, it gets very complicated very fast. Now, of course, there will be cost savings, and we should look at basic income as an investment in the country and in the people of the country. There's no doubt that there will be economic activity, cost savings in terms of criminal justice, healthcare, and other issues. So that's one important element of it that needs to be highlighted whenever we're explaining the cost, in quotation mark. We need to be talking also about the returns, just as you would with any other investment. But more broadly, we also need to have a discussion about how we're going to finance it and the political perceptions of that financing. The way that basic income is being talked about today, as well as on the Green Party website and in many other circles, is as a poverty alleviation vehicle, a tool to alleviate poverty. And that message, in our opinion, at least at Revenu de Base Québec, only resonates with a very small percentage of the population and strikes us as something that's going to be very hard to implement and to get through the various legislatures, whether it be in Canada or somewhere else. And earlier, Senator Pate mentioned that no one credible is in favor of a demo grant. Well, maybe I'm not credible, but certainly people at Revenu de Base Québec, as well as UBI Works and other organizations, are in favor of a demo grant, which is the main difference, just to briefly mention, is that all the money, the basic income, would be given to all members of society, and then revenues would be taxed back in different ways to help fund it, rather than just giving a basic income to those under a certain level, what's sometimes called a negative income tax. Now, there's financial advantages to that. However, there's a huge political cost. The reason Medicare is so popular is because it's universal, and everybody has access to the medical system, whether you're rich, poor, or what have you. So these are all questions that would merit, day-long conversations. But they need to be thought about, especially in the context of a political party such as the Green Party, because the way you finance it, who receives it, is going to fundamentally determine whether or not it's politically viable. Mm-hmm. So I would say it's a vast conversation. Yes, it's an investment in society, but that argument alone is not enough. There's lots of places we can invest money. So we need to have a broader, holistic vision of how a basic income could help us move society towards a greener, more sustainable economy, and also one where everybody has a fair shot in life.
Thank you, Jonathan. Well, certainly this is the moment to have those conversations. There is no question that there are various models, there are various approaches. This is exactly the time to begin that conversation, because one thing we all agree on certainly is that we need something to replace these benefits, which will disappear. Extension or not, these benefits are not intended to become permanent. They are not a permanent solution. And we face and confront the same question, which is, will we allow people to fall back into the same precarity that they faced before those benefits existed, or will we do better? Will we use this opportunity again to have the big discussions we need to have to move us toward a guaranteed livable income? So that is something we agree on, and I certainly intend to hold more of these roundtables and perhaps something a little more ambitious with Hugh and others, Kim. We've been speaking quite a lot about this issue lately. And I'm looking forward to having you both there. I'm looking forward to working with you on this. It is certainly something that's, I believe, whose time has come for all the reasons we've discussed this morning. Alors avec ça, je dis merci, et s'il y a des questions, je vais le passer à Rosie maintenant. Thank you so much, Jonathan. Thank you so much, Senator Pate. I'm very grateful for your insights this morning.
Thank you very much.
We will now say goodbye to those on Facebook. Thank you for joining us. Nous disons maintenant au revoir à ceux qui sont sur Facebook. Merci de nous rejoindre. And now we will begin with questions. One question, one follow-up. Nous allons commencer les questions. Une question, un suivi. Please use the raised hand feature if you wish to ask a question. Veuillez utiliser la fonction de lever la main si vous voulez poser une question. Merci. No questions? Est-ce qu'il y a des questions? No questions. So this will conclude the roundtable for today. Thank you so much, everyone, for joining us. Ceci conclut la table ronde d'aujourd'hui. Merci beaucoup à tout le monde pour nous rejoindre.